Local wound care itself. What are we going to put on it? Everybody's so focused on the dressing. I find that's what most people come to me and ask, well, what do I put on this? Great. That is probably about a sliver of what my focus is. A lot of it is going back to circulation. Again, regardless of what the etiology, what the cause of that skin opening is, it goes down to, can I get the blood flow carrying to it that's going to be able to heal it? If I cannot do that, that wound will have very, very minimal chances of healing. So it's optimizing that circulation. The local wound, what we put on it can help with both pain, assisting in the healing, as well as moisture is a big thing, drainage and things of that sort tend to be considerations. Patient-centered concerns. Pain is a huge one, and I know we're going to have a lovely chat this afternoon about pain, and I'm sure you're all very interested in that. When it comes to pain and wound healing, again, it goes back to circulation. Our bodies, when we're going through fight or flight and we're going through a stressful situation or we have pain because of an open area, in that sense, our body's natural reaction with the cortisol is actually to vasoconstrict further. Because if you're running from a wolf, yes, we have wolves in Canada. If you're running from a wolf and you slash your leg on a tree branch as you're running, your body is going to actually naturally clamp off the circulation to that area so you don't bleed out while you're running for your life. And then once you relax, you got away everything else, you notice that there's something going on there. Unfortunately, for our day-to-day when we are incredibly stressed or we have pain that's unrelieved, our body is still feeding into that feedback system of staying vasoconstricted. So it's harder for us to get the right stuff to that place to heal it if pain is an ongoing consideration, because the body just keeps getting that feedback that there's pain, aka I just slashed my leg on a branch while I'm running for my life. It can't interpret differently. So pain is a big thing. I find that I work very strongly with my clinicians and my team that I'm a part of. Cosmetic concerns. Some people are like, well, I don't want to go out like this. Like, that component of things when it comes to what avenues we choose to go. Limitations in activity, looking at, again, is this going to affect how well you're able to move, walk, open a jar? When we're looking at how aggressive are we to try to heal a wound, as per that lovely arm sleeve that you have to sit in for 5 hours a day, versus if we cut their finger off because it literally cannot heal, which sadly is sometimes the outcome. If it can't heal, it's excruciating pain, the patient is now at risk for infection that will affect more of their hand. We do have that discussion about what's the most important. So at that point, we look at what's the best for what the patient's goals are. And also lifestyle modifications. Both ways. How is this affecting your lifestyle? But what are you doing on, again, a day-to-day basis that's affecting how well your wounds will heal? My patients that get 3 to 4 hours of sleep per night heal in half the time of my patients that sleep for 8 hours a night. Your immune system, your growth factors, all of that work and regulate with your hormones at night. So if you're not getting, ideally for women it's 8 hours, men can somehow get by with 7. But any less than that, and your immune system is being affected by how well it's able to function, heal a wound, manage the inflammation in your body, all of that. People who sleep less are in more pain. But at the same time, on the flip side, you have trouble sleeping because you're in pain. So we find ourselves in this very difficult position when we're trying to work with things like that. But if it's just a matter of I need to turn the TV off an hour earlier so that I can get to sleep, so I can get that extra hour, it's worth it. Time and time again, it is worth it. So, okay, functional medicine hat off, back to this. So from the local wound care, so we've got a wound, say on the hand somewhere. What are our focuses? I need to get rid of dead tissue. So that black stuff that comes up, the yellow stuff that sometimes, I have a few pictures. Really, to be honest, I'm not sure why you guys put me between now and lunch. Usually I'm speaking to healthcare professionals and we will sit there and have a steak while we're looking at something. I try to be very selective, don't worry. But some of you have had instances where you've had open areas and you may have seen it or your loved ones where there are areas that are black or yellow or interesting colors that are not a healthy red. So in those instances, that tissue in itself is in the way of any new good tissue actually going to be able to come in and heal in. So sometimes, in some instances, depending on the degree of what's going on, I'll get my scalpel out and I will debride that down. In some instances, they're not ready for it. If the circulation is not good to the area again, we want to make sure that there's actual circulation to allow healing. So if you've got someone coming at you and your fingers are still really cold, don't let them touch you. You need circulation, or if not, we're possibly making a larger wound if we know it's not going to heal when we do go in there to help remove some of that dead tissue. So we'll certainly look at circulation before we do that. There's different ways, not just with my scalpel. Some dressings will actually help the body to lift that with time, and it's called autolytic debridement. It's why our bodies produce some of that fluid that we see come out of wounds to help. It's actually there to help rinse out some of the debris that's in there. So if you have a wound that has a lot of drainage coming from it, a lot of the time it's because that's your body's natural reaction to try and flush some of that stuff out. The other thing too, not to again gross you guys out, but maggots tend to be exceptionally well and very, very efficient when it comes to cleaning out wounds, especially when there's a lot of pain involved. Of course, these are medical grade in a lab grown. Don't go out to the dumpster like that. They'll work just as well, but I just don't feel as good about them. Then they come with their own level of risk. But that is another option that we do look at when pain is severe and we want to be very selective. Infection. Infection is a huge thing. When we chat in a minute about and go through the different kind of phases of how your skin goes about healing, infection is the #1 reason why a wound will not heal. And it's because it will keep that wound inflamed, it'll keep it angry, and the body's priority will be to kill the bacteria and not to heal in with new tissue. So if we're battling an infection, that will usually take precedence, and that needs to be addressed before that wound can start moving forward and healing. In some instances, that involves just a dressing that has some antimicrobial in it that'll kill the bacteria that's there on site. In some instances, we need some antibiotics. In some instances, it's a combination of both. And that's something depending on how severely infected the wound is, but also how well the host is able to fight infection as well. So how many bugs it takes to infect a wound on me, and how many bugs it takes to infect someone who's on a biologic, who's on something that's suppressing their immune system, which is their battleground to help kill that bacteria. The bacteria don't have to try as hard to take up shop and win the battle in a wound when someone's already battling so many other things and their resources are going so many other places. And we're actually, in a bit of a counterproductive way, trying to suppress the immune system to keep the scleroderma under control, but then at the same time we have an infection that the body's trying to fight with the immune system. And so sometimes we do look at possibly, in some of the instances, I'll work very close with the rheumatologist and actually dial back some of the scleroderma meds only until that infection gets under control again. Because there are instances where allowing the immune system to at least react the way that it's supposed to an infection, to allow it to clear that infection with our support, with antibiotics and dressings and things like that, and then bring you back up to where your therapeutic levels were before that. But it is that very, very touch and go, which is why infections in wounds are very, very severe for you guys, because we do have to make that decision sometimes of what's going to be the priority short term. And that's all I'm going to say about that particular point at this moment. The other thing is moisture balance, and this is just whether the dressing is going to dry it out or it's going to actually give you a little bit more moisture. If you have wounds that are very, very dry, usually wounds that don't have good circulation to them tend to be very dry, so in some instances you may see that. With the Raynaud's, in some instances I have people who have very, very moist they have the problem with they have too much moisture. It's getting on things that they're touching, things through their day-to-day, so they just want a dressing to keep the drainage off of them from the things that they touch. Whereas with some patients, it's so dry that the new cells that are trying to go across actually need a little bit of a medium, something moisture-wise for them to actually go across. I think the analogy that works best for me, if you look at a wound the same way you look at your front lawn, if you have a front lawn, somebody's front lawn that you know, you want that nice moist. You want your skin and a wound bed to be moist. If it's too dry, you actually have to add a little bit of circulation. So in the middle of August, if you have a drought and things are dried up, you have to go out and water your lawn or it's dying off. Same thing with your wound. If there's not enough moisture in there for the cells to actually take up shop and fill in and heal, sometimes we need to actually add a little bit of moisture through ointments and creams and things like that to allow for it. If there's too much, it's like if weaving tiles break and then you've got like all these massive puddles in the middle of your lawn and it drowns it out, it's also not going to grow well. The same with your wound. Too much moisture in a wound will also inhibit how well it's going to be able to heal. So that's where we kind of pick what dressing is going to go where. And the last thing is we get really, I've had 2 patients that I've sent for hyperbaric therapy, but it was pretty much a wound that was like a foot by half a foot around the lower half of their limb. And they benefited from oxygen therapy again because that's what our wounds need to heal is oxygen. And if the circulation is not going to bring it there, sometimes we need to be very aggressive with how much they're exposed to so that they get the most out of what is being carried down there. And negative pressure, so without being at trouble for using a consumer name particularly, but a brand name, VAC. I'm not sure, has anyone ever seen or had a wound that they needed a VAC for? All right, there's always one. It's that, you know what? It does beautiful, wonderful things. It's a great technology. If you ever end up with a wound that's significant and isn't moving along really well and you hear the docs go, ask for a VAC. They'll be like, what? To be honest, there are instances where we don't use them, but for the majority of wounds that have not healed, it is technology that actually will help promote new cells and circulation into that wound bed to allow it to heal. But there's a lot that goes into it, so usually we try the regular dressings first. So wound healing, so this is that lovely picture I was going to refer to. So whether it's a scratch or a paper cut, or it's a digital ulcer, or it's a leg ulcer, or it's a surgical wound, this is the exact same process that your body goes through every time you have a break in your skin and it needs to heal. So you're starting with, you get the blood flow through there, your body forms a clot, protects it, everybody's all hands on deck, and kind of limits how much damage is there at the site. From there we move into the inflammation stage. So this is why sometimes you get that red, a little bit of swelling. That's because that's your body's inflammatory response kind of rushing there to bring everything that your skin's going to need to heal. So that's why it looks a little redder sometimes. The trouble being, if your skin, because of the scleroderma, is too inflamed, sometimes we have to actually, in order for it to move into the next phase, which is proliferation, which is a fancy word for building new tissue, is what that is. In order for it to go into that phase, in some instances, we need to actually help along the if you're too inflamed, we need to bring down that inflammation, either just at the site or as a whole again. However, if at the other end of the spectrum, you do need the inflammation to a certain extent, and if you're on enough agents that's suppressing your immune system, that's where we have difficulty with it going from one phase into the next and moving along to allow that tissue whole process to fill in, and then forming a scar tissue over that. So that's kind of where most wounds, for a number of reasons, get hung up, is in that inflammation phase. And that's where when we look at some of the medications and what's going on in your skin, as to how we can help that whole naturally move along. Again, some of the, when we look at, especially this is for the upper extremities, ooh, goodies. Some So the Raynaud's, again, this is some of the medications, and this is where I rely very heavily on my rheumatologists. I more or less just kind of do my due diligence to make sure that they have at least been considered for some of these. There's a lot of acronyms on here, of course, but channel, in the Raynaud's, I'll look to see if they are on calcium channel blockers, SSRIs, or if they're on any kind of thank you. Thank you. Phosphodiesterase inhibitors. In some instances, I will actually have patients come into hospital for certain infusions because there are risks that go with them. And the prostaglandin, so when you have the digital ulcers and they're sometimes getting worse, we will end up sometimes having patients come in and have infusions of the prostaglandins very, very aggressively. Usually our success rate with that is very high, but they do need to come into hospital to receive it because of monitoring and the risks that go with it at the time, and usually that's when I end up seeing them. At home they may have been cared for by the home care providers out there, but then when they come in, now they're there and I get the opportunity to take a look at them and try to help them as best as I can. A little bit more stuff down there. So the calcinosis, and there's actually another table from an entire paper that's done just on calcinosis. And you know what, I think I might leave my commentary to that until that point. So, nutrition for skin support. So in your handouts, I had blocked out the vitamin A as well as the vitamin C considerations because it goes to like the higher end of 2 milligrams for vitamin C. And for the vitamin A, they have 25,000 units. And a lot of time in the scleroderma patients, I like to go down more to like the 15,000 units if I'm considering that for them. So that's why it's blocked out. I didn't want you guys running off to like the health food stores and going and getting obscene amounts of vitamin A as per the recommendations. So I wanted that opportunity to tell you it's actually a lower dose in a lot of the cases. But there is a lot that nutrition goes into. I work very close with my dietitians in the hospital in recommendations for wound healing. Big things additionally are protein. If you don't have enough protein, that's what your body uses as the building blocks to rebuild tissue. So if there is not enough protein to go around and it's too busy going off and doing other things in the body, then anything, we do albumin levels. Has anybody heard of albumin levels? Yeah, especially if you've got any kidney stuff, sometimes you hear about them there. If your albumin level is below 35, again, those chances of healing significantly decrease by about 30 to 40%. So we need those building blocks in order to rebuild the damage in the tissue. If not, again, it's a very long road. The longer that wound is open, the higher that chance of infection. So good nutrition is a huge part of what we focus on when it comes to wound healing for anybody. And zinc is another one we hear about. You may hear about quite a bit. Zinc helps with the actual DNA turnover of the tissue that's filling in. A lot of us who eat fairly well probably take a multivite, get enough zinc per se. Too much zinc is actually harmful in the liver, so it's not, again, something that I would encourage everybody to go out and start having a lot of. But in the instance where there is a wound in the context where the liver is healthy, a lot of times I will do a 15 to 30 milligram supplement for about 2 months or until the wound heals. So the Raynaud's, again, I think we've gone over that beautifully today. I wanted to make sure that I'm staying on time. Right? Yeah, no, people who work with me on a regular basis and know, like I have someone who sits there and goes 5 minutes, because I will just keep talking easily. So, again, it goes back to that episodic vasoconstriction. So again, the small vessels that are already tiny and being compromised by the scleroderma and that buildup of the collagen is anything that makes it constrict will put us at risk. So there's all the lovely little, to get an idea of how many vessels you've got, especially the ones concentrated up in your fingertips. We've got a lot of backups, but once they start going, we're running into a lot of trouble. So lights out, okay. Ooh. Without looking at your presentations, I want to give away my gloves. If You can name 3 lifestyle modifications to help reduce the chances of them coming out. First one to get your hand up and get it right. Yep.
Keep your hands warm.
Keep your hands warm. Give me 2 more. Give me 3. Ooh. Yep.
Tight control of diabetes.
Yes, and I'll talk about why that's important in a second.
No smoking.
No smoking. Okay, now what are you guys going to do this with one pair of gloves? All right, Joe, you had it first, so you come on up. You go. Either of you gentlemen not have gloves? Everyone needs
We
their
get
gloves.
the gloves. We get the gloves.
I will let you guys sort that out. Good, I am so glad to see that you have gloves, because honestly, I was like, mine are back in Canada this morning, so I'm like, deep in my pockets. So, keeping warm is number 1. Again, depending on where you live, can be more challenging than others. But make those smart choices. If you lose your gloves, tell the presenter to flip the slide. If you lose your gloves, figure out whether you need to stay in a little longer, borrow someone else's gloves, literally just grab a sweater and wrap it around your hand to get to the car. Don't drive with it, but warm up your car beforehand, that kind of thing. Keep those puppies as warm as possible. Smoking cessation. Anybody in here smoke? I see someone's like very shy hand, like over here. Some people don't put their hands up because they know what's coming when I say that. We go back again to the vasoconstriction. The chemicals in a cigarette will vasoconstrict your arteries significantly. So again, not only do you get the nicotine staining, which is not great if you have the Raynaud's, in addition to that, the smoking sensation for anywhere on your body. I have patients, other issues. They've got bad vessels because of high cholesterol and other things that have gone on in their lives. And they'll wonder why their foot wound is not healing, and I'm telling them because every time you smoke, you are cutting off the circulation and the blood flow to that area, and we are not making progress. So if that isn't something that you have made a part of your lifestyle decision yet, please consider. That could very well be what makes or breaks. Getting digital ulcers or having them heal when they do come up. Tight control on blood sugars and diabetes. The inside of, if you have diabetes or you're running very close with high sugars, the term now is pre-diabetes, if you're in that category of risk, trying to keep a very close eye on your blood sugars, because when blood sugars run high for long periods of time, the sugar will actually start to irritate the inside of those arteries more. That's why patients who have diabetes end up with trouble where they have the most concentration of small blood vessels, the eyes, the kidneys, and the feet. So that's where they tend to run into trouble with small vessels. You have small vessels in your fingers. So one of those things, again, on the day-to-day, that can be very important to how well your body's able to function and limiting how much damage happens, would be that, as well as hypertension. If you have this constant bounding blood pressure against those small capillaries that are already very fragile, it can start to cause a little bit more damage and inflammation if you have that bounding effect on the arteries. And stress management. If you have a lot of stress going on, that will also flare up Raynaud's. Has anybody ever noticed that? You're going through a very stressful period of time? Yeah? Some stuff? So again, that movement that we were talking about earlier, the meditation, the yoga, great for the blood flow in a physical sense, also great sometimes in being able to have that mindfulness and that mindset reset to allow for our bodies to relax, and again, decrease the inflammation that's running through our body that's causing the scleroderma to be aggressive, but also to reduce the effect that it's having on the blood vessels immediately. So when I'm looking at it, I think we've kind of gone over a lot of this. I look at the dressings. These are 2, and I have them on the next slide so you guys can see a visual of them. Polymem and Manuka honey, or Medi honey is the trade name that I happen to use that particular one in my hospital. If there is any deeper infections, we certainly need to address that. Again, there's bone very close there. If you get an infected digital ulcer, there's an opportunity for the infection to get into the bone. That is a whole new level of hurt. So, if that is the case, or they suspect that, you need to be on IV antibiotics. So, there's that infection part of things again. We do have prostaglandin ointment that we can put right at the site, but in some instances we do end up going very aggressive and doing the IV infusions for those instances. Pain management, which we talked about, and the surgical intervention part of things. If we've been losing the fight, the infections starting to spread, becoming more aggressive, in some instances I do call upon my surgical counterparts to look at isolating and cutting away the dead tissue that's not healing, because sometimes we do need to weigh out the risk to benefits, and sadly that's when we start losing digits. So the sooner that we can prevent, the sooner that we can intervene, the much better the possible outcomes, and you get to keep your fingers. So I might sound a little crude when I say that, but I see it a lot. And it's the little things again, the day-to-day, that make the difference in the end. So those are the dressings of choice. If they're not available to you by chance through a clinic or a healthcare professional, you can get these off Amazon. Very low risk. The Polymem, what I love about that, it comes with like actual little finger dressings that you can roll on nicely. The good thing too is that it actually has an anti-inflammatory in it, and it won't affect you systemically, so it'll actually help inflammation right there at the site. It has a polymer in it that will help with inflammation. Manuka honey as well, it's an antimicrobial. It adds a little bit of extra moisture, and it will help with some of that debridement that we were talking about earlier, lifting out that dead tissue. It does a beautiful job of that. That being said, Billy Bee honey is not an appropriate dressing. You can get Manuka honey. Manuka honey is specific because of the pollen it actually has from the bush that it's harvested from the bee. It's fun. You can get that usually over the counter in most like health food stores, a good quality Manuka honey, but obviously you don't want to be putting it on your toast one day and putting it on your wounds the next. If you're buying it for that purpose because of accessibility and financial resources, then please keep it obviously as clean. Use a new dipstick every time you go in there to try to keep it as clean and cross-contamination to a minimum. I wouldn't keep a jar of it longer than a week for the purpose of your wounds. So don't get a big honking thing and be like a golden. Get the smaller one, because chances are after a week, because of the opportunity of bacteria to get into there just from being open, you don't want to leave it for longer than that. Quickly we'll go over legs. Again, they put me right before lunch. So some of the times with some of the skin thickening, this is what happens. The skin eventually erodes, breaks down, and then you get the openings, infection gets in, it becomes chronic, and then it's a hard mess to clean up. The longer it's open, the more it's infected, the more aggressive we have to be. And these are the ones where I start talking to my rheumatologists about, is it possible to back off a little bit on some of their anti-inflammatories for a period of time, because part of the reason that they will stay open is because of that. So if we can catch it nice and early and we can do that preventative skin care beforehand, these are possible situations. Luckily, only about 4% of patients with systemic scleroderma will end up with leg ulcers. Thank goodness. I just tend to see a lot of them because that's what I do. Again, everybody's different. There's a lot of comorbidities. Not only is it sometimes the small vessels in the skin because of the scleroderma, but it's also if they have larger vessel issues because they have venous insufficiency. Anybody have friends, family, or even themselves who have bad veins in their legs? So as I see the nods, we're not even doing hands anymore, we just see nods, okay. That's an additional. Some people will get wounds just related to that. And sometimes with that being the case, you'll open up with ulcers because of the venous insufficiency, but then on addition to that, trying to heal, we're trying to work within the context of the scleroderma as well. So that's a part of things. We will look at the large vessels and what's going on with those in some instances. These little guys, spider veins, in and of themselves, not a harmful thing. They're more of a cosmetic issue for most people. We can have them removed with laser, but for the most part, a lot of the time, it's if you use like a cover-up, a foundation that has a green tint to it, is a complementary color to red, it'll actually bring it down a little bit more than just the regular skin tone stuff. That's my pearl of wisdom for those guys. Do we have time to go through the calcinosis? Okay. Okay, good. So again, it's been very well reviewed this morning. I'm just going to talk kind of more to the piece of kind of the wounds and approach as we come to them. Again, when they're in the pads of the fingers, it's very difficult for them to not end up ulcering and opening up, especially if the Raynaud's is a piece of that. In some instances, about half the patients, they don't end up opening or causing enough pain to really have to aggressively go in, but sometimes that's more when it's in the forearms, in areas that aren't being in contact with things all the time. Okay, so that's, I promised that I would have a nice little chart. And so this was just lining up. They did a study and they looked at many, it's actually done through the Mayo Clinic. Were you a part of this one? Probably. Another one through the Mayo Clinic. So they looked at 78 patients that came through with the calcinosis and the different treatments that they had tried. And at the end of the day, the only ones that actually had complete resolution was the colchicine, one. Some of them had no response and a partial response. And this also speaks to the fact that there's so much going on in the context of that person that this is why one size does not fit all with scleroderma. But your outcomes, really, the highest success when medications aren't working for you, the highest is actually to have them surgically removed. I find most of the time, if the scleroderma is being well controlled, that surgical wounds actually heal very well on you guys because you do have that collagen very readily available to fill in the scar tissue. Is just making sure that the circulation part of things is also optimal. So I find that these usually, when done well with a good hand surgeon, will heal very well. The reoccurrence rates, I actually don't have a stat for that, but my personal or my professional opinion is it's rather low. The one thing I just want to make sure that I do run through is the nutritional part of things, because it's partly about how your body uses calcium, is looking at what your vitamin D levels are and what your magnesium levels are. Both of those will help your body determine where your calcium sits, and if either one of those is out of balance, in some instances, it's just one of those little extra things that can help to make sure that the calcium in your body is going to the right places, like your bones and your teeth, and not into your tissue at your extremities. So I think on that, I will take some questions. Yes? Is calcium citrate bad to take as a supplement? Do you have someone monitoring your blood work for your calcium levels? Okay. I would recommend to have someone take a look at your blood levels just to see where your calcium's at. What were they recommending the calcium for? So the questions around calcium citrate and taking that, something that's just kind of been on board as part of the supplement plan for years, newly diagnosed with scleroderma, and wondering if it's something that should continue. I would say if you're going to continue, I would certainly have blood work done to see where your calcium levels actually are right now if you need to be taking it. The other thing would be to complement it with at least, especially if we're not getting a lot of sun and your vitamin D from the sun, is to at least 1,000 units of vitamin D per day. Vitamin D3, not vitamin D2. There is a difference. The bottles will say that.